We have DG CCRUM, Dr. N. Zaheer with us.
Can we have the certificates also? For the this thing. Hey, Dr. Ahmed.
Yes, ma'am.
थोड़ा different होना चाहिए हर साल.
So now we'll start felicitating our experts. Dr. Vishnu Gupta sir.
Sir, yes, sir. Sir.
Dr. Muhammad Fazil sir. Dr. Ahmed
Yes, sir.
Saeed.
Sir, look here, sir.
Sir,
Thank you. Yes, sir.
Moving on to the participants. We have Dr. Shakira Begum from Andhra Pradesh. Dr. Gufran Najib from Chhattisgarh.
Sir, ये ज़्यादा बेस्ट है.
Dr. Sachin Bakshi from Haryana. Dr. Iqbal Ahmed Kar from Jammu and Kashmir.
आप लोग लेते जाइए, बाद में अपने अदला बदला कर लीजिए अपने certificate.
Dr. Iqbal Ahmed Kar, Dr. Rahmatullah and Dr. Muhammad Naeem from Karnataka.
Sir.
Dr. Rahmatullah and Dr. Muhammad Naeem from Karnataka.
Yes, sir.
From Manipur, Dr. Ajima Begum. From Madhya Pradesh, Dr. Syed Mohammad Abbas. From Madhya Pradesh, Dr. Syed Mohammad Abbas.
Sir. Sir. Sir.
इधर देखिए. Please don't take individual photographs. ये खराब हो जाता है फिर. है ना? You will get टेढ़ा photographs then.
Dr. Muhammad Shahid Khan
Yes, sir, look here.
from Punjab.
थोड़ा सा.
थोड़ा पीछे एक एक करके एक एक करके
Dr. Muhammad Naeem from Karnataka.
Please.
From Manipur, Dr. Ajima Begum. Dr. Syed Mohammad Abbas from Madhya Pradesh.
Ma'am.
Dr. Muhammad Shahid Khan from Punjab. Dr. Nissan Ahmed Khan from Rajasthan. And Dr. Sarfraz Ahmed from Rajasthan.
सर एक एक करके
Dr. Nisar Ahmed Khan and Dr. Sarfraz Ahmed from Rajasthan.
Wait, sir, wait. Yes, look here. Thank you.
Dr. Jalaluddin from Tamil Nadu and Dr. B. Nazia Tabassum from Tamil Nadu. Dr. Jalaluddin and Dr. B. Nazia from Tamil Nadu. Dr. Sheikh Mohammad Asim from Telangana.
Sir.
Dr. Muhammad Makbul Hussain and Dr. Sheikh Mohammad Azim from Telangana. Dr. Shaini Khan from Uttarakhand. Dr. Siraj Ahmad Ansari and Dr. Mohammad Saqib from Uttar Pradesh. Dr. Siraj Ahmad Ansari and Dr. Mohammad Saqib from Uttar Pradesh.
Yes.
Sir.
सर
See this side. कोई बात नहीं, आप चेंज कर लीजिए, एक्सचेंज कर लीजिए बाद में.
Dr. Mohammad Saqib. And Dr. Arshad Ansari from Delhi. Dr. Arshad Ansari from Delhi.
Distinguished Dr. Raghu, Advisor Ayurveda and Deputy Director General, Ayush Vertical, Directorate General of Health Services, Dr. Gauri Nambiar, Director CHEB, resource persons from CCRUM institution, and esteemed participants from different states, and with the background of I hope that you all belong to government service. Namaskar, Assalamu alaikum, and a very good evening to all of you. At the outset, let me express my sincere gratitude to the organizers for having invited me to this valedictory function of this modular training program on metabolic disorders for Ayush master trainers. Well, first of all, let me convey my heartfelt gratitude, appreciations, compliments and congratulations to the whole team behind this document which is there in your hands, the SDGs on metabolic disorders. It was not possible without the active support from the Directorate General of Health Services, Ayush Vertical. Particularly the credit goes to Dr. Raghu for successfully bringing out this document. As you are all aware that this journey was started with the successful publication of certain SDGs on musculoskeletal disorders a few months back. And well, the third document on dermatological disorders is already submitted to Ayush Vertical DGHS, and hope in the coming days that will also be published and will be in your hands. Friends, this SDGs is has a lot of significance. As you are all aware that as of now, we see there is a difference of approach towards the patient health care when it comes to Ayush treatment. So that's the reason the Government of India, Ministry of Ayush, in collaboration with DGHS, has ventured into this aspect of developing SDGs on different conditions based on systemic disorders. The very purpose is that this document must be put into practice in toto. As you're all from the government service backgrounds and being the master trainers, well, there is a lot of responsibility upon your shoulders to disseminate this knowledge which you have acquired today. And in the coming days, you would be training your medical officers from your respective state on these SDGs. The idea behind all this is to cater to the public masses a standard uniform quality care. So that's the real objective of this document. Well, the day it was published, I have seen to it that this document is uploaded on our website so that it should be readily available to the all the stakeholders. And wherever I find the opportunity of addressing any gathering, I doesn't forget to mention about these particular developments which are taking place in through Ministry of Ayush, whether it be developing SOPs on different Ilaj with Tadbir regimens, or it is concerned with standard treatment guidelines. We see to it that this knowledge is disseminated. Unless and until it reaches the grassroots level, at the level where our doctors are placed in PHCs, the purpose of organizing this master training program will not be achieved. So you have an onerous responsibility to execute in a manner which will be easily understandable, explainable, and you take this message to the medical officers of your respective state. Well, the main problem, I have went so many places and used to ask them whether they have gone through this document, the musculoskeletal disorders initially. But many of them unfortunately said that they haven't. Then I asked them to go and see the CCRUM website so that they can download this document easily. And now various CMEs have been organized by CCRUM also, funded by Rashtriya Ayurveda Vidyapeeth under Ministry of Ayush. And we have taken up one such CME is on metabolic disorders. And one such CME held in Hyderabad and as well as in Chennai also on musculoskeletal disorders. So I have particularly asked them to include this document in one of their CMEs so that this message should reach to the utmost maximum number of doctors. So with this objective, we have ventured into developing SDGs, and you will also be happy to note that CCRUM is also engaged now in development of standard operative procedures for Ilaj Bit Tadbir regimens also. You would be aware that already such a document has already been published on the popular treatment technique, that is cupping, which is even I have sent that document to the in the international groups also. So they were all appreciating about such a document being developed by CCRUM under Ministry of Ayush, and this document is going to serve them a lot while they perform this procedure. On the same basis, now we have taken up 6 more regimens, which includes massage, douche, leaching, fumigation, vaporization, and we don't do this from our own side. We take the help of all our stakeholders. Dr. Abbas Zaidi is here, who is an expert in leaching. We have taken his expertise in finalizing that SOPs for leaching, and very soon that will be sent to the professor level experts, so that once they vet it, we will be able to bring out those SOPs in the public domain. Likewise, as on date, there is no standard massage tool available for any Unani physician to diagnose the temperament of a person. It's very unfortunate that we have not been able to do that. But now that standard tool, for the past 1 year, this exercise is going on, and now we have started that the pilot study by allotting a few number of samples to our 2 main institutes. Once that data is generated, then we will be conducting a large multicentric trial wherein this questionnaire will be further validated. So once that is validated, first it will be in the manual form, later on we will be taking up in a mobile app form, so that it should be readily available to all the Unani physicians. So a lot more developments are taking place. So I once again beseech all of you to take this message of the training which you have undergone here on metabolic disorders to all your medical officers in your respective state, so that the purpose of developing this document is fulfilled. I once again thank the CHEB for providing this platform to our medical officers, Dr. Gauri Ramyarji, and as well as I once again express my sincere gratitude to Dr. Raghu and his whole team for successfully bringing out this document. With this few words I conclude. Thank you once again. Jai Hind.
This metabolic disorder, all of the metabolic disorders which we are discussing since morning. Cannot we have a table type wherein we can put the obesity on the top and decide the treatment principles on it? Secondly, add on the tree that if the patient is having the hypertension, we can add these type of treatments. If the patient is having diabetes associated with it, we can have these type of treatments. If we can have the gout, we can have these type of treatments. Will be a uniform for whole of the country. Otherwise, we are from different. I belong to the Kashmir. We are having some different treatment plans. Other state is having different treatment plans. If we are having the uniform, a tree type, that will be the more precise, as I think so. Thank you, sir.
We have noticed it actually, and as far as the SDGs are concerned, this is actually, generally it is uniform guidelines have been evolved. Only the thing is that what you say that there is a need of developing some kind of specific algorithm in terms of actually, and even we have to notice that even without obesity also, many of these clinical conditions can happen. As an obesity only is a precursor for all other conditions. So we need all these separate guidelines, but only the thing that we are again going to do specific algorithm for each of the, not only for metabolic disorders, even for the musculoskeletal disorders, which actually even the Honorable Member DPIO also suggested us to work on that actually. So we will be working and finalizing it also. So that will be useful to you. But what way I would request you to that continue this training program in the states that as we suggested in the morning also, district level and further at the block level, so that different regions and big states like UP, you can do in multiple regions first. You can identify your resource persons there. From there, you can percolate down the line with the training program. So whatever the resources required for that purpose under the state national Ayush mission also, you can appropriately propose so that within next 6 months these training programs has to be completed. That's what we would like to request. Yes.
Sir, one more question. Of Central Research Council in promoting or giving the feedback to the respective UTs or the states while you are having this extramural funding. Suppose I am working in a GMC, while I have full facilities. So because of the lack of funding, I cannot go for the research. So is any this research funding you can go in this while we have facilities of this GMCs or district hospitals across India?
Actually, for organizations to follow all the codal formalities, and there is a central sector scheme under the Ministry of Ayush, under which extramural research programs are actually supported for the various organizations. Yeah, whatever the research are done through the research councils under the IMR, intramural research. In addition to that, what I am saying that extramural research programs are also supported. For example, if you are already government Unani Medical College, which is there in the Kashmir or Jammu, then those institutes also are eligible for applying for these EMR funds actually. So you can apply appropriately.
We are encouraging the state government Unani Medical Colleges to have tie-up with the Central Council for Research in Unani Medicine's peripheral institutes. We encourage that actually. See, you may not have sufficient infrastructure in your colleges, okay? But RNM Srinagar has all the wherewithal, okay, in terms of manpower, infrastructure. So you can tie up with them, you can devise certain proposals in collaboration with them. It will be a joint project, okay? Then if there is merit in that, that can be submitted through IMR proposals, intramural research proposals. We will not give the funds to you, rather we will give the funds to our institutes. You can work in tandem with them.
Thank you. Thank you.
Thank you.
So thank you all. So continue this zeal. Yeah.
Second one is to organize compulsory district level training session for each district for medical officers of Ayurveda, Homeopathy, Unani, Siddha, at least once every 6 months with a provision of additional session if required. And the third one is the program schedule can be like this that we have concluded today, like for the different disease conditions and one for the for the modern experts. And the pre-post-assessment questionnaire can be given like that we have circulated today. And the monitoring and evaluation can be like pre-post test, number of trainings conducted at each level, preparation of IC material can be done by this STG, number of participants attended the training, training completion reports, date, location, topics covered, participant details, and recommendation for the next round of training, and reference assessment and patient satisfaction before and after the STG trainings. This is a long-term work.
Any comments? Things, or you're mandated to do these kinds of trainings. Anybody would like to add or delete anything from this? This is still in the process of being developed. So the training plan of action will be developed. And what we are planning is to call the state program managers, because ultimately the funding will go through NAM. So you will all be the experts because you're all the master trainers. So the reporting that will be created will be in conjunction with the master trainers as well as the people who are going to be conducting the training programs. So I think the state will decide as to who will conduct and how it will be done. So this is a format of a guideline kind of a thing, that minimum this much needs to be done. That is being done. And the second thing is we would be, like you rightly pointed out, an algorithm is required, but simultaneously, this is a very thick booklet. You can't give it to everybody when you are doing trainings. So what we were thinking of is to prepare a very small booklet of around 5 to 10 pages, in which each page would be specific to one particular topic. So that is something which is like a handy thing which you can give to all the participants. It will be very easy to distribute also. And जो भी ट्रेनिंग के लिए आ रहा है वो वापस जाएगा तो उसके हाथ में कुछ होगा, आपको देने के लिए भी कुछ होगा उनके साथ में करने के लिए. So that is something which we will try to develop. These are the two things that we are planning.
So training for, because you may not have that kind of authority to conduct a training program, so we will write to them actually. So we will write to your along with your names also, because we will say that you have been trained as a master trainer. So with your support, this training has to be conducted further. In that way, we will be writing.
Yes, sir. That's the difficulty we are facing, because I attended the musculoskeletal disorder training program. After going to the state, conducting the program is very difficult, as the state won't take any responsibility. So I request your authority to kindly mention them that they have to do it compulsory. They are thinking it's what we call optional, whether it to do or not. So circulating this message is important. Then maintaining that what we call to conduct that program, that is also important. So they are thinking it's not a mandatory, and they are skipping up, and they are leaving it up to us only. We have to maintain everything, from the speaker to each little thing, arranging a what we call lunch or something. So it's very difficult for us.
Collectively, as a team, that is very important, because sometimes we get the letter from the directorate and nothing is specification is done.
But at least by this time you are well aware about how to conduct the training.
Exactly.
Only what is required, you need the permission and resources.
Exactly.
That's two things.
Exactly.
For which we will writing to the states actually.
Exactly.
See, I agree, because last 2 days we've also been hearing the same thing, and that is why I think we sat and we decided that the state program unit should be involved in this. But the other side of the story is also true. Lot of times master trainers go back to the state, and even if given funds, do not conduct, do not report, because उनको लगता है कि भाई पैसा इन्होंने दिया, इनका काम है रिपोर्ट बनाना, हमारा काम नहीं है. So the onus of training lies between both, right? Because you are the technical experts, and if I may call them, they are the financial providers. So it has to be between both the parties. What we are expecting is the bare minimum. आप और करना चाह रहे करिए, बहुत बढ़िया. मेरे ख्याल है डॉक्टर रघु ने और कविता मैम ने फर्स्ट डे ऑलरेडी बोल ही दिया कि फंडिंग के इशू नहीं है, चिट्ठियाँ जो भी चाहिए चली जाएंगी, लेकिन काम होना चाहिए.
So thank you all.
First of all, was to promote Unanis and all sort of that is the concept that has been going on. Already the researches are there that has been published by you, researches from different colleges. The books have been published by you, so please kindly arrange us for that. So we can spread as more we can as what is going on. So it's a humbly request that from your side. The small booklet, the research is whatever development takes place, we see to it that it is there on the website. And the books which we are coming out, we even have a QR code in that. So you can download it from anywhere. So you have to just keep on visiting our website.
Talking about the physical.
Want to waste papers. We have seen that experience. So many books were lying in the storerooms without using, or spoiled. So we are limited number of copies are now only for the libraries. We give on request. Otherwise, for individuals, we don't encourage. We have the digital copy, the new books which are coming out now. I'm saying. So those are all links available in the website.
Thank you. Thank you very much.
Thank you.